everyone, welcome to 4Sides TV with me Anjali. We have been watching a spate of weird policy makings around the world, and one such happens to be that of the current New Zealand government's policy to reverse the smoke ban introduced earlier, setting the ball of controversy rolling all across. Here's a special report from 4Sides TV. It is the conducive time for the people of New Zealand to unify their aspirations in cherising a kind of society basing itself on the solid foundations of community wellness and well-being in setting across those governmental legislations which are directly in the contravention of public good. New Zealand's new government says it plans to scrap the nation's world-leading smoking ban to fund tax cuts. The legislation introduced under the previous Jacinda Ardern-led government could have banned cigarette sales next year to anyone born after 2008. Smoking is the leading cause of preventable deaths in New Zealand, and the policy had aimed to stop young generations from picking up the habit. Health experts have strongly criticized the sudden reversal. Most health groups in New Zealand are appalled by what the government's done and are calling on them to backtrack. The legislation passed last year had been acclaimed internationally, with research models backing the key reforms. Measures included restricting the number of tobacco retailers and reducing the level of nicotine in cigarettes. Modeling had suggested the smoke-free laws could save up to 5,000 lives each year. New Zealand's laws were believed to have inspired the UK government in September to announce a similar smoking ban for young people. A national Maori health organisation, Hapai Te Hauara, called it an unconscionable blow to the health and well-being of all New Zealanders. Smoking rates and associated disease and health issues are highest among New Zealand's indigenous Maori population, for whom experts had said the policy would have the most positive impact. The government is flying in the face of public opinion and obviously in the face of the vast majority of people who work in this field, health professionals, doctors, nurses, said Professor Edwards. Public health modelling conducted in 2022 had shown the smoke-free policy would have saved New Zealand's health system about $790 million over the next 20 years. New Zealand still aims to reduce its national smoking rate to 5% by 2025 with the aim of eventually eliminating it altogether. More than 80,000 adults have quit in the past year, its national data shows. Currently, about 8% of its adult population smokes, and the future seems bleak as the nation indulges in policies contrary to public welfare and community health, spreading waves of gloom once again.